the Reflection Show with me, Martha and Spice. We want to have an amazing conversation on fibroids. Every woman, every young girl, anyone that has a woman in their life should make sure that they pay a keen attention to this episode because it has become a major issue affecting most women. We used to think that it affects older women, but unfortunately now it even affects younger women who probably have never even put to bed before. It is something that we need to prioritize in our health care system or even personally as our health as women. Let's make sure that every one of us understand this perspective of our health. Let's take a break. When we are back, we delve into the conversation. Hello everyone, today is a great day. We met over 250 women here to inspire them and to empower them. The focus was to make sure that the widows that we have in our society, the single mothers, the women who are bore twins and probably not have enough on them, the pregnant women that may not be able to go for antenatal, among other vulnerable women. The target was 250, but we reached 271 women. I believe that whatever target that we set and whatever reach that we have been able to achieve has helped a lot of women to become better. It was a day for us to talk as women. They shared their perspective on women economic empowerment, teenage pregnancy, taking care of their children and how they can do better. We danced. We modeled. We had fun. And I believe that seeing these women chill and enjoy themselves at this point, it's something really amazing. So the Martha and Spice Foundation, with support from few of our partners, we had some donations from the Universal Merchant Bank, UNB, and some individual philanthropists who helped us to make this day a success. We gave them bags of rice, bottles of oil, tins of mackerel, some tins of tomato paste. Some got soap, some got Dettol, some got cloth, some got even macaroni, and a whole lot of things. Clothes, shoes, handbags. We were able to distribute to these women, and we believe that they have been able to support us greatly. Thank you to Glow Events for glowing the whole setup for us as well, and to Aki's Kitchen for giving us an amazing time of lunch to refresh and to entertain these women. We really appreciate everything. We are glad that we touched the lives of these women. Welcome back from the break. We want to look at fibroids and encouraging every woman or anyone who has a woman in their life to be careful, because you need to be able to check yourself all the time. I have here with me a midwife. She will tell us her name and we delve into the conversation. Thank you so much for joining us.
Thank you.
Tell us your name.
So my name is PO2 Apabe Simona Alimswe.
Eish. Thank God you had to mention it yourself. Thank you so much for coming. Really appreciate your time.
You're welcome.
We want to look at uterine fibroids. What is it about?
So, all right, like you rightly said, uterine fibroid is gradually becoming quite an alarming situation, and most especially for we Africans. Okay, so before we start, we should all know that uterine fibroid is usually something that affects more women because it has to do with the uterus. Okay. And we know men obviously don't have the uterus. So uterine fibroid, or what we call leiomyomas, or you might hear somewhere fibromyoma, is usually a growth an extension of muscle tissues that is usually found within the uterus. We have some really coming inside the uterus, and outside. When we get to that point, I'll let you understand. But basically, we say they are called myomas, benign myomas, in the case that it is not cancerous.
Okay.
When you have a uterine fibroid, it doesn't necessarily mean you have cancer. No, it is not cancerous.
Okay.
So it devolves. And one thing we should also know that is that in women, when you take about 100 women, you have about 90%. So 2 out of every 3 women basically will present with uterine fibroid. Another thing is that it is also very common in Africans. I don't know why, but because of our genetic background. So we tend to get it more often than our white counterpart. So it's very common. And that is the reason why, like you said, we need to be more careful. We have women living with us, we have our mothers, we have our sisters and our wives. Also, with the uterine fibroid, you will see it coming, you see it more evident in ladies between 30 to 49 years. Okay, but usually when someone has not started puberty, if you've not started menstruation,
okay,
you are likely not to get fibroid.
Okay.
And then as you advance and get to the extreme of ages, 49 years and above, that is when menopause is gradually setting in. We realize that there is going to be a shrinkage or a reduction in uterine fibroid. So what I'm basically saying is that before puberty and right into menopause, then you see it. But right after menopause, or when you gradually get into menopause, it tends to reduce in its numbers or how it presents.
Okay.
Also, with uterine fibroid, we are dealing with the uterus. I think maybe next time we need to get pictorial evidence.
Yes.
Yeah.
Okay.
So we are dealing with a uterus, which is an organ in the female.
Yeah.
And when you look at fibroid, it can sometimes grow as a single tumor. You see it as a single growth, or it comes in clusters. What we say cluster, a cluster of, schools, clusters. So comes small together to form a cluster. Okay, and uterine fibroid can be as small as a grain.
Okay.
Rice is a grain, if I'm right.
Yes.
Bean, it can be small, and it can also be as big as a watermelon. Yes.
Wow.
Yes, it can grow as a grain, and it can grow to as much or as big as a watermelon. And I think we are all growing, and we probably would have seen or heard somebody having fibroid. And sometimes you look at the person, then they say, oh, the person is pregnant, but this person never gives birth. So that is the extent to which it is. Can be small, and then it can be as big as a watermelon.
What are the causes? Are there some causes to this?
Yes, so generally when we look at the causes of fibroid, when you read science, they tell you that there's no clear-cut cause. It's not like malaria, where we say Anopheles mosquito goes through a cycle and gives malaria.
Yeah.
No. One thing about myoma or uterine fibroid is such that there is no clear-cut signs depicting. But like I said, when we look at the risk factors or things that can predispose you. Once you are an African, you have a higher chance of getting it as compared.
Just being African.
Just by who we are.
Hey.
Yes, just by who we are. Secondly, being a woman in your reproductive age. And then thirdly, if you have a family history of uterine fibroid. So a sister of mine, a direct auntie of mine, my mom, somebody who might have had it in life, it predisposes me to having it. So like I said, there's no clear-cut point for fibromyomas.
Okay, you've mentioned the risk factors.
Yeah.
And being an African and being in your puberty stage, are there other causes, like risk factors, like maybe what you eat or what you drink?
Yes. I think for some time now, we are all known, or we all get to know that diet. It looks like diet affects basically everything about us. So our diet. So if you are somebody who is more towards the red meat, fatty foods, and instead of doing red leaf vegetables like we are being educated, doing less of the oils, yes. So the diet is one. Two, another risk factor is also you being a young lady who hasn't given birth. Like I said in my introduction, it usually happens between puberty and till menopause. So not even giving birth is also a risk factor for you. Okay, and then also we have genetic hormones. Women, basically, we have so many hormones, but there are two main hormones, that is estrogen and progesterone, that has a direct link with the formation or the growth of uterine fibroids. Okay, yeah.
So it means that you have to probably look at putting to bed. Some say you have to put to bed early, or when you are putting to bed, you have to be very careful.
Yes. Well, yes, that is it. But usually, fibroids doesn't usually have a more direct link.
Okay. To fertility.
Yes, when we get to the effects, I'll elaborate on it. But yes, we have people who have fibroids, but they are pregnant or they've given birth.
Okay.
So it doesn't necessarily 100% give rise to fertility issues. Yeah. So when I was talking about the fibroids, I think we have to think about the types of fibroids we have. So basically, we have about 4, right?
Okay.
So when you take the uterus, please, if I'm speaking more of medical jargon,
I would draw your attention.
yes, because I think the aim is to just let
the uterus is
ordinary,
basically the womb, right?
the womb,
where
yes.
the baby lies.
Yes.
I've also learned some medical stuff. Where the
yes,
baby lies.
baby lies, yes. So when you look at the structure of it, it's in layers. You know, it's just like the skin is in layers. It's in layers. So fibroids can be attached to either the muscle part,
Okay.
that one we call intermural. Okay, it can also be attached to the serosal. That's the inside, the outer layer of the uterus.
Okay.
So it could be inside. It
So
could
when
be
it's inside, that is where the baby is lying, inside by the baby.
Yes, that is submucosal. That is within the uterus.
Becoming down intra what?
Okay, so we have intramural.
Okay.
That is within the muscle layer, myometrium.
Okay.
Okay. Then we have the subserosal. Serosal is just the outer part of the uterus. And then we have the submucosal. The mucosal, that's the mucous line that is more into the uterus. Okay. So I think basically we just needed an anatomy of the uterus. So we should know that we have intramural. There's one that can form in the muscle layer, some inside the uterus and some outside the uterus. Then we have some we call pedunculated. Those usually they grow, but you found them on a stalk. You know, a stalk, it grows like it has a base that is growing on it, more like mushroom.
Yeah.
If you know mushroom, you see how it grows. So we have pendulated. So with that one, it can attach to any part, but not directly on it, but then it grows. So it attaches and then grows on it. Okay. Then now we have something we call cervical myomas, in a sense that instead of developing in the uterus, what we know mainly is in the uterus. When we talk of fibroid, it has to do with the uterus. But now we have it growing, or some 1 to 2% have DS growing at the opening of the cervix.
Okay.
So it's cervical. Yeah.
Okay. Now let's look at prevention. Are there ways we can prevent this? Let me give you one. By not being an African.
so it means that by not being an African, yeah, but you know they do get. But what we are saying is that yes, we more likely, yes. So you can't necessarily prevent uterine fibroid. You can't necessarily, because once you're a woman, estrogen and progesterone comes to play, coupled with other risk factors, it's quite sometimes difficult to say you are preventing.
Yeah.
But if you want to talk about prevention, probably you can just try to do the modification of your diet. So things or your risk factors, what predisposes you, you withdraw away from them.
Yeah.
Of course, we cannot stop being Africans, but modification, smoking, like we are told, drinking alcohol, like we are told, so we can reduce those, and then
things.
Yes. But I must add that usually with fibroids, the symptoms are usually asymptomatic.
I was just going to come there about symptoms.
Yes, usually you can have the fibroid, but you will not necessarily be showing signs. You know, I talked about the fact that some can be small and depend on where it's located.
Yeah.
And then an instance where it grows to be the size of a football or a watermelon, you see those ones are obvious. So with the symptoms, usually it's asymptomatic. And sometimes we get women coming to the clinic, probably not to come and report of uterine fibroid, but probably you are doing other investigations. You are probably doing a scan, or the person presents with other signs and symptoms. Then maybe you decide to go further, and you realize that it's. But when you tend to have larger fibroid, they tend to give you some signs and symptoms. So if the fibroid that we are talking about, it grows within the uterine cavity, because it's inside, me and you cannot see, obviously, unless through a microscope or more imagery something. But when it happens to grow large, the uterus of me and you who are not pregnant, well, I don't know, but me and you who are not pregnant, it's usually very tiny. The uterus actually is very small, like a bean sort of. But you know, the moment you pick seed, then it begins to expand.
Wow.
Another thing that can let it expand is the growth of fibroid. Yes. So if you have the small ones like green inside, your uterus might not necessarily be so big to even click like, okay, let me, maybe I'm not pregnant or I'm pregnant. But if it tends to grow and over time it grows out of proportion, then you realize that the uterus or the womb, I think, let me use womb, the womb begins to enlarge and then open up to get more space to occupy that growing myoma. So myomas, I should add that they are being fed by our blood. That is how they grow. They are fed by our blood. So once you are a young lady, you are not in menopause, progesterone and estrogen, which are hormones, are all playing and they are acting well, then there is much blood supply. So they tend to grow. They just keep multiplying. That is how come if you do not detect it early, it can result in it growing to a bigger size. So now when it grows into a bigger size, that is when you begin probably to start having signs and symptoms.
Okay.
When it is even small and it's within the uterus and it's containable, one classical sign is you realize that there will be irregularities in your menstrual cycle, your menstruation, your daily, your monthly flow.
Like fibroids can really affect that?
Yes, please. It can affect your menstrual cycle. It can either reduce your days. So if you're somebody who was bleeding 4 or 5 days in a month, it can reduce it to 1 or 2 days or even 3 days. You see, that's why usually we encourage young ladies to keep track of your menstrual cycle. So that if this month I bled for 3 or 4 days, and the consistency, is it normal blood flow? Does it come with cloth? How is the color? Then with time, when there's a little deviation, you are able to pick it up. But if you're somebody who you don't really
care about it, when it comes. And
there are some people who are actually okay with it not coming every month. But if you are not sick, nothing is wrong with you. The uterus is supposed to shed the blood off to make way. I think
sometimes we are not okay. It comes because it's stressful. Even if it's not very painful, you know, the stress, the discomfort, what to even wear, like wherever you are, sometimes what to even wear at that time of the month, it's stressful to choose what to even eat. So if I've not had sex, I've not done anything, it shouldn't come. It shouldn't even come for 3 months or 6 months. It shouldn't even come.
And at some circumstances, it's okay if it doesn't come without any. There are some people who actually can miss their period for 1 or 2 months. And there's no underlying medical condition, or it doesn't mean
you are pregnant
or something. You know, maybe that's a topic for another day, but stress can affect your menses. The food you eat in a particular month can affect your menses. There are so many factors. So coming to some of the signs and symptoms, like I said, in an instance where it hasn't grown and pushed the uterus. So we always say that in a non-pregnant person, the uterus is very small, in fact, very small, just lying somewhere. And it's always within your hips, let's say your hips, but it's when you are pregnant that it moves out of that area into the abdomen. That is how come gradually it gets bigger by the day. So with the smaller fibroid, which, like I said, usually is difficult to know you have fibroid. Sometimes we just pick it up. Maybe you've gone to your hospital, they are doing a scan, what we say scan, then the doctor realizes you have fibroid. Or maybe you are pregnant, you go for your routine scan, then the sonographer tells you that, oh, I can see some myomas and all things. So it is usually asymptomatic. It doesn't present with symptoms. So that's how come people are actually roaming with it. They don't know because it doesn't give you any symptoms.
But you can just walk into a lab to just see,
yes,
let me
please,
check. And would they see it no matter how small it is?
A good sonographer.
Okay.
A good sonographer, yes. I say a good because, yes, all sonographers, but sorry to say, depends on the person's level. A good sonographer should be able to pick even the smallest one, like a rice grain. Yes, the good sonographer should be able to pick. The machine picks it, and then you are able to read and interpret, because their reading is always in the form of some dark images and
yeah,
beyond.
I know, right?
Yeah. So with the signs and symptoms, like I'm saying, it can present as irregular menses. Either you get it this month, you don't get it the next month. It flows for 2 days. The next time you come and flows for 5-6 days. It becomes irregular. Okay.
Yeah.
And then usually another sign is that sometimes they complain of feeling full, like bloating. The person can come and like feel like bloating. Those are some of the signs they present in the consulting room. They feel like they are bloated. And if the uterus, the fibroid is the one that is big and has really grown and it distended the uterus, you can tend to have pelvic pains. Okay. By the uterus, we have so many organs. Internally, we have so many organs that is within. So it's like when there's pressure. So let's say you have your liver, and then there are other organs that are near the liver. The kidney is behind there, and those. So when one is distended or enlarged or swollen, it tends to put pressure on the next organ. So if the uterus is swollen, it tends to put pressure on the bladder.
Yeah.
So some will
the bladder is where the urine is stored.
Is stored, yes.
Okay, I want us to get where the urine
is stored. So it tends to put pressure on where the urine is stored. So now, also depending on how it is shaped, how big it is either going to push on the bladder or where the urine is stored. And so you're always going to feel like going to the bathroom. I want to pee. You feel like urinating every time.
Yeah.
If it's also present in a form where it obstructs the bladder or lifts it, it's possibly going to be reduction in your urine flow. So you see, it looks like it's left and right something. When it's on it, then you realize that more time you need to empty because you feel the agency to urinate often. And also, if it is in such a way that it lifts it or occludes it, there's going to be the retention of urine where you might not be urinating frequently, and that can give rise to infection, because if you keep storing urine, we say urine are byproducts or so many things, you need to, that's why most of the tell urinate to clear your system, urinate. So if you are somebody who doesn't urinate frequently, there's retention, you are keeping urine more time, then realize that you are likely to be presenting with urinary tract infections. Okay. And then another classical sign of undiagnosed, let me say undiagnosed fibroid, because unless you are diagnosed, could be infertility.
Yeah.
Infertility in the sense that, like we said, it can grow on any part of the uterus.
Okay.
Now, when there's sexual intercourse and then the female egg and male sperm, they meet, and then there's fertilization, it's supposed to swim down through the fallopian tubes and then finally embed or get attached, that's the formation of baby, get attached to any part of the uterus. So in an instance where there's a fibroid which happens to grow around the fallopian tubes, it's going to block the incoming baby. I'm just trying to believe. You're a bit confused.
No, I'm trying to imagine what you are saying.
Yes.
Because the fallopian tubes is one
You
at
see
the
them
side.
like this.
One, yes.
Yes, you see them like this. So when there's fertilization, we always say when the male and female, the mate and then baby is formed, it has to travel down the fallopian tubes
Yeah.
and get implanted or get attached to the wall of the uterus. That is with baby formation. But in an instance where a fibroid has decided to grow just at the entrance of the fallopian tube, where would the baby pass to go in? So you realize that the person is there, person is not giving birth, keeps trying. Also, if it doesn't even block the baby from coming to be attached to the womb, and baby finds its way into the uterus, but baby has decided to embed or settle at this part of the uterus, and that is where Madam uterine fibroid is hanging on. It means that baby might have to what?
Yeah.
You might have to miscarry.
That's true.
So those are some of, we are talking of the signs and symptoms of fibroid. But I just had to bring the infertility, even though it's also on its own. But sometimes some of those are also things that can prevent you to try to go for further maybe investigations or scans. Okay, yeah. And with the pain, like I said, usually it's mild. But we have instances where it becomes severe. That is like I'm saying, if the growth is so massive that it pushes the uterus and it goes to put pressure on adjoining organs like the bladder or even the rectum. It can also give rise to constipation. So another sign and symptom of fibroid is constipation. In fact, constant constipation, where the person probably finds it difficult to have free bowels. You know, at least we should have free bowel every day, but at least every 2-3 days. But people will present with constant constipation. Yeah.
Now, we've spoken a lot about that, and you said that mostly with women, when they are at puberty and upwards, it can affect them and all that. But I want us to take a break. When we come back, I want to look at the treatment options.
Okay.
And fibroids, I saw a doctor after a surgery in a video. He had fibroids in a pan.
Yes, it's true.
And I'm like, so all these were in the woman's tummy, or how do you put it?
It grows up to the size of a watermelon.
Yes.
So well, when we come back, well, we have some people saying some of these pictures they are circulating.
Yes.
No, please, it's true. We have instances, we see somebody who has fibroid. The person looks pregnant. That's someone who actually look pregnant, like 9 months old, but it's fibroid. So it's true.
And they might not know that it's fibroid. They would think it's pregnancy till.
Yes, some, especially those who are,
Maybe
sorry to
not
say,
like
desperate for
literate.
pregnancy.
Okay. Yeah.
If you are desperate for pregnancy and it happens like that, and probably it comes with the one that doesn't let
Make
you menstruate.
You
And then your abdomen keeps growing, and because of what is already in your mind, you are expecting a baby, so automatically you think it's a baby.
How? I pray that no woman goes through this, and you're already going through that. I pray that you just wake up one day and it's vanished from your stomach. Let's take a breather. We'll be back.
My name is Naima. I have a challenge with my aunt since I was in basic 5. If I'm in class learning on the board, it reflects. So I can't see well, I can't read well, so I have a problem with learning. So when I heard about the eye screen in Matter Research Foundation, I decided to come over and see how it will help me, and I'm very happy to be here today.
Welcome back. We are still looking at fibroids and how you and I can stay safe and strong so that we don't get to that point. Now let's look at the treatment options. Once you realize you have fibroids, what is the first thing you have to do?
Okay, so thank you. Coming to once you realize you have fibroid, like I said, you really need to be more particular about certain things or about your health before you can really get to know you have fibroid. Because most times it's like I said, it doesn't present with symptoms.
Yeah.
And if it's just about the mild symptoms where we talk about probably low abdominal pains, which is intermittent once in a while. I think even with that fibroid, sometimes you happen to get low abdominal pains, and maybe sometimes the irregular menses, like we said, doesn't necessarily mean you have fibroid. So before you are even able to get to know you have fibroid, before we even get to what we are going to talk about, the diagnosis, like we said, usually we entreat that let's make sure we get our diagnosis from trained healthcare providers. We are particular about this because I'm sure you and I have heard people saying they have treatment centers for fibroids. They have this tea, this herbal.
See, that will melt it.
Or melt it.
And I always wonder, looking at how sometimes it can be big, if it's like the early stages, maybe it can come to like your menses and stuff. But assuming it becomes big like an apple or what, it will be so discomforting.
Let's say watermelon. Imagine it's big.
Yes.
Like, how do you melt it?
That will take like a whole year to practically
Probably
melt.
even more than a year.
Unless maybe the melting just crashes it, but it will look like a baby is coming out if it's going to melt in a day.
Yes, yes. So usually, like I was saying, just about the diagnosis, I will just entreat our younger selves, our mothers and women, that let's try to get our diagnosis from trained healthcare providers. And before they are able to come out to say you have fibroid, not based entirely on the symptoms you have presented, some will carry out a scan, basically what we call a scan. They'll put you down, put a probe, they're able to scan to get to know that you have. Okay. And another method is we have something we call pelvic examinations. Okay, so usually there are also some particular scans, not necessarily the one we do for the pregnancy, but more advanced ones, which are transvaginal. That one they try to, it passes more through the vagina. And then you are able to get to know the exact location, because even getting to know the location of the fibroid actually enhances the treatment options. Okay, and even getting to know the size of it. If it is so small that probably you can be kept on, usually they use progesterone therapy, that is like the IUDs or Depo-Provera. There are some injections. If it has to be a medical one, they can just put you on any of those medications. But when it is so large that it's actually difficult to shrink it or difficult to reduce it to a non-existent one, then we might end up having surgery. You might have to. And even with that, there are so many types. So with the diagnosis, like I'm saying, make sure you get it from a qualified healthcare provider. Let them get to know what exactly it is, where exactly it is, how big or small the whole thing is, and it will help in the treatment. Also, another method they can also use to diagnose, apart from the scan and then like the transvaginal probes and those things, we have something we call endometrial biopsy. In that case, they just pass a machine, something small, into the uterus. They pick a part of it, then they send it to the lab, do series of lab investigations. So they're just taking biopsy, they're just taking a part of it. They do series and then they're able to come out. We have something we call hysterosalpinography. That is usually done through the fallopian tubes. There are all ways to get to know or diagnose one, get to know if you have fibroid or not. Okay, so you talked about treatment. So usually we say we have medical and surgical.
Okay.
Medical is when they will have to put you on medications to shrink.
So it means that genuinely, it's possible that if it is small, it can give medications to take to shrink it, and shrink it, and
it shrinks it and then reduces the size. But usually, you see, it doesn't unless otherwise. But it's not cancerous, and unless maybe it gives you so much pain. Usually, fibroids usually do not worry. That's how come, like I said, we are roaming with it. We see people roaming with it because it's not something that will usually send you to hospital and you are down and then those kind of things. And so with the medical, I was talking of medication, just normal medications. If you have the backache and whatever, they probably prescribe, the doctor will prescribe some analgesics, let's say paracetamol, brufen, to contain the pain. Okay. And also, because they are small, and you know, like if they are small, and probably maybe I finished giving birth and I don't really want to give birth. So even if it's in the uterus, it doesn't really give me so much concern. There's no infertility issue coming in. And if it is not large and they're doing the medical, they'll only just treat you coping strategies. Probably they'll tell you that if you are there, you have the pain, try to adopt a position, try to do warm, just get a warm towel, put it around your abdomen to relieve the pains.
Okay.
Okay. And if it's an instance where it gives you, like we said, some urinate, frequent urination, some do not urinate at all, and if there's an infection, then they can treat with antibiotics.
Yeah.
Okay. But that is the medical. Okay.
Yeah.
The other issue is the surgical. And the surgical is in folds. They can do the surgery to remove the fibroid. I think per what you were saying, that there was a viral photo of a doctor holding whatever. So that possibly would have been done by surgery, because if he didn't do the surgery, he won't be able to scrape and remove it. So usually with the surgery, there are also various types.
Yeah.
We have the type that you only go in to remove the fibroids. You go in to remove the fibroid, and that is usually called myomectomy. Just go in to remove the fibroid. And then we also have some we call hysterectomy. With the hysterectomy, they just remove the entire womb. After all, if there's no womb, there's no fibroid. But that is usually done. Amazing, eh?
That's done maybe after you have finished giving birth, or
Yes,
if you understand that
Yes.
you can never have a child anymore.
Yes. You see, you can shrink fibroids, right? They'll give you medication,
Yeah.
or they can even do a myomectomy. They can remove the fibroid, and you can give birth.
Okay.
Having fibroid or having treated fibroid doesn't mean you can never give birth. Please,
Okay.
no. You can. So if it is somebody who has finished delivery, let's say finished, she or the family plan, they no longer want kids, they're okay, and then they realize that your fibroids are big, and probably maybe you're presenting symptoms to worry you a lot, then they go in. You see, because it is being fed by our own blood, it's like we
Yeah.
are sharing our blood with them.
Yeah.
With the fibroid, when I say them, we are sharing our blood. So most times, another classical sign somebody coming in with fibroid is anemia, low blood levels.
yeah.
Because like you are sharing your blood with something that is growing. As I was saying, in some instances, some other treatment, they might just give you some injection to shortcut oxygen supply to the fibroids. So when that happens and then there's no blood supply to the fibroids, they tend or they cease to grow. Yes, it's been fed by the blood.
Okay.
It gets blood. So once it's also nourishing well, then it also grows well, right? So that is it with the treatment. Either they do a myomectomy where they remove the fibroids, but it doesn't mean you can't give birth afterwards. Or they will have to do hysterectomy, where they'll have to entirely remove the whole uterus. And that is done.
Imagine how a woman, no, but I know people, even there was this Nigerian actress who, she's married, and she said it herself, and other people came that her whole womb has been removed.
Yeah, it happens.
And a mentor of mine whose wife, for them, they are lucky. They had 2 kids, a boy and a girl.
Okay.
Then she had some conditions and they had to take her womb out. And sometimes I wonder, like, you are working, you have no womb, like.
Yes, it's normal. As you are sitting down, you are not pregnant, I should say. And like I said, if as a midwife, I've been a midwife for so many years. If I just put you down and I want to palpate and locate your uterus, once you are not pregnant, no, I won't be able to. Because in the non-pregnant uterus, it's something like this.
Okay.
It's just like
so
this.
if I'm not pregnant, you will not see
No.
my uterus. You won't even locate it. You won't even feel
No,
it.
when I touch, no matter how I touch you, I won't be able, because It's so small and it's lying somewhere. Cry.
But once I'm pregnant, it opens up and it makes itself available, just like
Yes.
it makes itself available to be examined.
Yeah, it starts
Oh, nice.
growing out. So that's why in my earlier speech I was saying that, let's say it's hiding. So we say somewhere in your hips, layman is hiding. But the more you become pregnant and baby starts growing, gradually it gets out of its comfort zone and pops out into the abdominal cavity. Then it starts growing. So it's usually difficult. You can't palpate a non-pregnant uterus. So if they remove the uterus, she has finished giving birth and they remove the uterus, nothing changes. Nothing changes. Probably the only change will have to be with her menstrual cycle. Maybe,
Okay, so
yeah.
does it affect the menstrual cycle, or you don't menstruate again in your life?
Oh, the uterus, menses is as a result of the shedding of the uterine wall.
Okay.
So there's no uterus, so there's nothing to shed. There's nothing to clean. You know, menses basically, we say, some people call it monthly cleaning or something.
Yes.
So it's because the uterus has to shed, it has to wear off. It keeps wearing off every month. Once you do not pick seed, you are not pregnant, and then information is sent to the brain, hormones are released, it tells the uterus, oh, there's no baby for you. So it has to clean itself. So if there's no uterus, then there's nothing to clean. So obviously.
Wow. It's getting me
Yes.
to
Yes.
really think a lot about this fibroid thing.
Yes.
I'm told it's really expensive to treat.
Fibroid. Yes. Not well. Expensive is relative. What might be expensive for you might not
But
be expensive.
it involves a lot of money. Like you have to take the medication,
No.
do the surgery to take it out.
No. So basically, what I know about the treatment of fibroid, if it's the medical where maybe the fibroid hasn't grown so much, it doesn't worry you. It's just some small. You know, they'll do the scan. Then when they do the scan, they're able to measure. It's measured in centimeters. They're able to, the scan picks and measure. So when it is just that small, like a grain, like a bean or something, it doesn't worry.
Yeah.
And then they probably have to do the medical treatment. Most times they just have to put you on the antibiotics. That is if you have accompanying infections, or they'll put you on the analgesics, that is Pimol and Brufen and others. Or they'll just ask you to, there are some family planning methods, that is, you know, we have the family planning method, they come in folds. We have some that are estrogen and some are progesterones and some are combined. So they might put you on progesterone, okay. And like I said, you see, as you are growing within the age of 30 to 49, you know, everything is high. Everything about you is high. Your hormones are high and those things. But as much as you keep approaching menopause, they tend to reduce. So in menopause, if you have fibroid, that hasn't really grown to a bigger size. As you approach menopause, they begin to shrink on their own, because estrogen and progesterone, that is also one leading factor or something that affects their growth, keeps reducing. So you see, realize most times when you're approaching menopause, they come with I don't menstruate, my menses, until gradually you cease menstruation. It's because at that time, the two hormones that are basically for that are reduced to an extent that it doesn't really have much effect. So as you approach menopause, if you have fibroid, it tends to shrink on its own. So when you get to menopause, it doesn't really affect you that much.
Okay. Now, to a young girl, we hear that sometimes if I said menopause, can fibroid prevent fertility?
Yeah.
It can.
Yes, it can. Like I was explaining, that depending on where it's located.
Okay.
If it's located at a place where the fertilized, the male and the female, when it comes together, before it forms a baby, they are series. It has to travel through the fallopian tubes and get embedded or attached to the uterine wall. So now, imagine a fibroid is found on the way or the pathway. Let's say the fallopian tube, it passes through the fallopian tube. So if there's quite a significant fibroid, it can block
the fertilizer, them to get
it can
fertilized.
block. So you realize that if you don't shrink it or you don't get it treated, then it's like that is the pathway. That is the only way. There's no way a fertilized. Yeah, there's no
because
way.
Because when the sperm is coming, it's blocking it to go and then.
Yes.
Wow.
So if the egg forms and then it's coming in and then there's an obstruction, it means obviously you wouldn't. Okay, but then that will now send us to maybe a later date details of in that case where you hear of IVF, people are saying they can implant whatever. But even before any IVF or any other secondary method,
I'm told it's stressful. You have to take a lot of injections.
Oh yes, IVF is not for the faint-hearted, and it's quite expensive. That is what is even more expensive than
I'm told you have to like take injections, take medications, and the timing is with those that those say take 2 in the morning, take it in the
timing is more important.
The timing is important.
Yes.
You have to even then have to inject yourself.
Yeah.
Hey.
Yes. So with the infertility and women in this case, like we are saying, so that is one thing. So realize that probably the woman everything is okay, but because of the fibroid that is blocking the baby from coming to the uterus to be embedded on the uterine, realize you keep trying, it's not possible. And like talking about infertility, so now maybe there is no obstruction, it flows inside or it goes inside the uterus, but now when it goes inside the uterus, it's supposed to attach to the uterus. You know, the uterus is an organ and it's going to be attached to the uterus. I know we've all heard of placenta, or we've seen placenta, so you know it's a formation, it's a whole lot of science there. So when it implants or gets attached to the uterus, then cell division and everything comes into play. Then the baby, the cells divide, and the pad starts forming whilst it's still attached. But imagine that there's a fibroid all over your uterus. It means that implantation cannot even take place. The moment it gets to the wall, there's already something planted on the wall, and it can't implant on the fibroid, so it comes out as miscarriage. So you get miscarriages often. Okay, and also another thing is there might not be obstruction. There might not also be an obstruction in its implantation. The uterus is okay. Maybe fibroid is found on one side. Baby has decided to implant on one side. So another thing is that there's always an anatomical or a correct way where the placenta has to attach to the uterus. So if the placenta comes to attach where it's supposed to attach and it goes there and something else is there, it might be forced to attach somewhere else, which can lead to an abnormal attachment of the placenta. And yes, pregnancy can progress, but it can also give rise to another medical condition called placenta abruptio, where it can lead to, because if it's not the correct attachment, even abruptio, there are so many things that come into play, but if there's no correct attachment, it can lead to abruptio. Is like all of a sudden it attached and the baby is growing, and at a point it has to come out. And also, if the baby is growing in the uterus, so like I said, you can have fibroid, you can get pregnant, get to 9 months, deliver safely. Okay, but in an instance where there's a fibroid in the uterus, baby is growing, and the fibroid is large, baby will grow all right, normal human being. But if the fibroid is large and is competing with baby, it makes the baby to have a low grow, like we call it IUG, intrauterine growth retardation. Baby is supposed to come out with a good weight of 2.5 and above. That is for a normal baby. But because baby is competing with something else in the uterus, it's not able to get the space to explore, to kick, to grow to its full length. So baby comes out and you realize that there's intrauterine growth retardation. And then fine, you are also there's uterus, there's fibroid, there's baby growing. Now you come to give birth. And one other thing, one other effect, when we're talking about, okay, maybe we'll come to the complications of it, but one other bad aspect about uterine fibroid is such that women who have uterine fibroid, they go to the full 9 months of pregnancy, they give birth, mostly bleed after delivery. That is what we call postpartum hemorrhage or PPH. No, it's normal to bleed after pregnancy. It's normal to bleed, but there is
and what's the normal one? What's the normal? How many days?
No, not necessarily have to do with the days, but we are just dealing with the amount of blood. Midwives or doctors have a way to quantify it. So when it is beyond the normal quantity that you are supposed to.
Okay, that's like immediately after delivery.
Mostly, mostly. Even though it can happen immediately, it can also happen within 24 hours or even after. We have something we have primary postpartum bleeding or primary bleeding after delivery, and then something we call secondary bleeding that usually comes after 24 hours and then above. So that is with the, and with that, I thought of placenta abruptio where there is a sudden detachment. Okay. Yeah. Then we can also talk of placenta previa. Previa in the sense that, like I was saying, because fibroid is fighting or struggling with the baby and the placenta, instead of the placenta being attached to its correct position, because it has not had the correct position because fibroid is already sitting there, it goes to attach at any other part that is not medically, like, that is not the normal. Okay. Yeah, so sometimes when we talk of placenta abruptio and previa, it's also so much. Okay. Then it just has to do with maybe one that you can bleed when you are in pregnancy, and then one that has to do with where it is positioned. Yeah. So yes, we can have fibroid. You can get pregnant.
You can give birth. That's why sometimes doctors say that they can wait when you are giving birth, then they'll just take the fibroid out.
It's no, please. They only do that when they are doing surgery. If they are doing a cesarean session.
Oh, okay.
That if you are doing, but you don't, mostly, one other thing is that when you give birth and the fibroids are so large and they have to take it after, let's say the CS, they have to remove it. You realize most doctors don't do it
at that time.
Like the uterus is an organ, and then you have finished delivery. They have removed placenta. There's a scar on the uterus, and that is what is going to bleed. And I imagine they are going to scrape and remove fibroids. The woman will be bleeding. So mostly depending on the size.
Like, and the man will say, what do you bring to the table?
We bring a lot to the table. We bring a lot to the table, and it's not easy.
Let's look at the complications. We don't have a lot of time. The complications then.
Yeah. So with the complications with fibroid, like I said, it's not too alarming. To say I have fibroid, it shouldn't be something that will send me shaking, because it all depends on the size, where it's located. It depends on the presenting symptoms or the problems it gives you. So with the complications, usually it's just going to be either they have their normal menstrual flow, or which is either going to be normal or heavy. Okay. Another complication is when I was talking about the baby and then the placenta issue. Yeah. Another complication is I can give rise to what we call placenta previa, because it can lead to a sudden detachment of the placenta. Can give rise to where the placenta will have to get attached somewhere else. So sometimes you realize when you go to the hospital or they do scan, then they'll tell you that the placenta is supposed to be either in front or behind, anterior or posterior. But sometimes you realize that they tell you that, okay, your placenta can be anterior or posterior, but then some people have the placenta low lying on the cervix. The placenta is supposed to be somewhere here, but you realize that maybe if you have fibroid, it won't be there, but it's going to lie and close the cervix. The cervix is where, when you go into labor, it stretches and the baby comes. So imagine placenta is blocking it.
It will block the baby from coming.
And it's dangerous because when somebody comes with such a thing, and maybe the person has done a scan, because now it's okay, because now it looks like even when you go to the remote villages and things, they are all doing scans, and then because some of those things are diagnosed using scans. You can't basically, or when the person comes in labor and you do examination, then you realize that what you are touching is not baby's head, it's not baby's leg, it's a placenta. You don't, and even in instances where a scan tells you this person is having placenta, the placenta is lying at the orifice, you don't even go in, you don't touch, because touching the placenta, using your finger to touch the placenta, can even let the woman bleed and bleed to death. All right. So another complication, like we are saying, apart from the menstrual irregularities.
After this, I said I want to have twins, but please, I wish I could just wake up one day and see babies lying by
No,
me.
it doesn't work like that.
Having to go through all these things, childbirth.
Yes. You see, pregnancy and childbirth is a whole lot on its own. And like you said, when men ask what we bring to the table, I keep telling them that we bring ourselves to the table,
Yes.
and ourselves is enough.
Because when there was pregnancy, the men will say, oh, we are pregnant, my wife is pregnant, but she alone enters the labor ward.
Yes.
All the scars and everything is on her.
Yeah, the pain and everything you have to endure. But then it's also nature. That's how God has made it.
God, this
Yeah.
kind of, in our next world, please forgive Adam and Eve.
They just need to go and apologize.
Adam and Eve should have gone to apologize.
Yes.
If they had apologized, maybe we
Yes,
wouldn't be
yes.
stressing.
Yes.
Maybe God will just let men sleep and he will remove their ribs and create more human beings. But it's really, give us your final words on this. What we must know, what we must take seriously, and how we can get to the hospital to get help or access to solutions for fibroids.
Okay, so to conclude, like we all agreed or we said earlier, as women, being a woman is even something that predisposes us, being a woman, because it occurs in women. And being a young person who have started menses or menstruating, you haven't entered menopause, is also another factor. So we just need to take our health seriously. You do not necessarily have to wait for irregular menstrual cycle, having abdominal pains, or having any other symptoms. We can, I know it's quite expensive, so sometimes when we talk, we just need to put ourselves in the shoes of our ordinary people who do not even have access to basic things, where we say, okay, why wouldn't we have regular checkups? Having regular if you can, it's good, have regular checkup, because you can walk into any facility, just tell the nurses and the doctors, oh, you want to have a regular thorough checkup. They will give you options where exactly which part of your body, then they carry out the labs and then the scans and whatever. So fibroids is, like I said, it's not something that has a direct cause like malaria, and I'll tell you that don't sleep outside, avoid mosquitoes, and then you wouldn't get it. No, we actually do not have 10% hold of it to say that, I can control it.
Yeah.
If it will come, it will come. But then let's look at our risk factors. Being African, there's nothing we can do about it. Being a woman, there's nothing we can do about it. But let's look at our lifestyle. Smoking, taking alcohol, eating more of red meats. Yes, we can do. Yes, eating more of the red meat. Exercises play, controlling your diet and things. It all plays. There is some are not really direct treatment like medical or surgical, but everything about the body is programmed in such a way that when you tune your mind to do something and you aim and you keep doing it, the body tends to align. So I think it's not only in fibroid that we are hearing that control your diet or do exercise, but it looks like it's now part of, it's a basic health necessity where everywhere you go, even if you are treating malaria, the doctor will still tell you that eat well, still control your diet and do exercise. So basically, apart from our lifestyle modification, let's try to do regular checkouts. If you are there and you hear or you can drag a sister, drag a mother, drag a daughter who is menstruating, just go have some labs, have some scans, and then they're able to pick up. And wherever the treatment is, I will entreat that wherever the treatment options are, please take your time. You can always have a second opinion. If you come to madam and madam tells you that this is my treatment method and you think it's not okay, you go to the next person. Let's be on the lookout for our own help. Let's seek treatment in as much as we can. I know it's quite difficult financially, but small.
Thank you so much for coming. It has really been very interactive and engaging. Personally, I have learned so much on this. I think the last time I went to do a general scan or a general thing was last September. I have to go again because this fibroid things you are mentioning, it's better you detect it when it's very small.
Yes.
So you can treat it and make sure that it is sorted. Because
Yes.
this one of it becoming big, like, hey, no.
Like
no.
watermelon. So you see people walking with it, they have it, and it's like watermelon. But the moment they remove it, then that is it. They remove, they are good to go.
So even those who are even walking around, who may have big tummy, you are wasting money doing exercise, please go and check. It could be fibroid.
Yes.
I actually hope so. That was by the way. It's been an amazing conversation here on the Reflection Show, and I believe that this episode has given us more perspective on our health, even as women, so that we can take caution in some of these things. And to the men, you understand that the women actually go through a lot in just trying to stay healthy and have babies for all of us to grow with. From now onwards, we'll do better and prioritize the health of women. Thank you so much for watching. I'm Martha Winspice. Do have a good night.